if there's leaky gut because of lipopolysaccharide, which is cell wall component. It really is a very remarkable back and forth interaction that we have with, and typically, when we're talking on this level, we're talking about the bacteria, the symbiotic bacteria, the ones that do things for us, or the commensal bacteria, the ones we just kind of live with, or the dysbiotic bacteria, the ones that have the potential for causing harm.
Yeah, you mentioned the lipopolysaccharides. Just for our listening audience, that is the toxic element that harmful bacteria or pathogenic bacteria spit out or spew out or excrete, just like we excrete, microorganisms excrete as well. They poop too. so
Right.
so that's what we're talking about right there. Listen, is there a connection between the type of bacteria that a baby gets exposed to at birth and the microbiome that they develop later in life and how that affects their health?
Right. Oh, absolutely. Basically, babies are born relatively sterile. And, yes, there can be bacteria in the uterus, but it's a very small amount. If there's a lot of bacteria in the uterus, then we're already talking in an infection and problems. But the moment the baby enters the birth canal, they get inoculated with the bacteria that were in the birth canal. And, because their mouths are open and they're coming through, and those bacteria will go down and populate the colon. And the mother's vaginal microbiome has been influenced by her own colonic microbiome from her colon and anus. So in a sense, we're inheriting mom's microbiome. And in a lot of cases now, there are studies that show definite differences between babies who are born by cesarean section and don't go through the canal and children that do. And in some institutions, it's standard practice to inoculate even a C-section baby with mom's vaginal contents.
So if they don't get exposed to the mother's vaginal microorganisms, and I call that, by the way, the baby's first baptism. They get baptized and come into that birth canal with those microorganisms. But if they don't,
right,
then they could develop basically what they're getting exposed to, what's in those practitioners in that delivery room, what kind of bacteria they have on their skin. And that's
right.
what's supposed to be going inside the gut, right?
Yeah, I mean, or any exposure. I mean, we're suddenly exposed not just to what's coming from a practitioner, but what's going to come from a family member being held or skin one when they're suckling on mom's breast, breastfeeding, or what's anywhere. I mean, the interesting thing is our environments are rich in bacteria. When you try to do studies looking at lipopolysaccharide in blood, one of the things that's so difficult about it is getting test tubes that don't have lipopolysaccharide in them, right? The blood collection tubes that are sterile enough that they don't have, bacterial cell wall components in them. So yeah, all sorts of influences like that. And then, to carry forward your point, the difference between breastfeeding and non-breastfeeding is going to greatly influence what goes on in that regard. And then, really a lot of changes take place in that first year as the immune system becomes online, becomes stronger, starts paying attention to what's there. Influences, are there antibiotics given early on? Influences like at what point child starts eating and what it is that they're eating and what those conditions are like. We recognize the hypothesis, the kind of the clean hypothesis in terms of some of the atopic diseases like asthma and eczema. And did we get exposed to dirt just as children and have enough immune stimulation? So there's all of these factors. But it's interesting to note that by the time we're 2 years old, we've kind of bookmarked what our internal environment's going to look like to a certain extent. Our immune system calls that normal for us, and there's some back and forth, but that's pretty much it.
So there's research that shows that the children who are born C-section have a higher incidence of, as you said, the asthma and other types of dermatitis and other problems. Is there other problems that you know of that is triggered by those inability to get the good bacteria from the mother?
There's some thoughts that perhaps some of the autoimmune conditions.
Interesting. I never heard that.
Yeah. So
like,
it is, but it's, no one has drawn deep connections yet to that.
We're just at the beginning stages of this whole thing, but it's really interesting. It's intriguing to see how these things are showing up. Early studies are showing up, and it's quite promising to know that we can make a difference by preventing these things. Especially, you said, if we can inoculate the baby early on, even if they had a C-section. I know a lot of birthing centers will allow the parents to be able to take some of the mother's fluids and rub it on the baby's head and maybe put it into the mouth. They allow that as well.
Right.
For that.